One of the main goals of diabetes therapy is to reduce your risk of complications.
I think a good way to think of diabetes is that it's a condition that affects your whole body. On its most basic level, it's a metabolic disease, meaning it affects sugar control and sugar metabolism, but it has an impact on your whole system.
Probably one of the most common connections between heart disease and diabetes is the role it plays in accelerating the rate of coronary artery disease.
All diabetics should have their blood pressure measured every time they go to see the doctor. Diabetics should have their cholesterol levels checked at diagnosis. So if you're an older patient and you're beginning an exercise program or intensifying an exercise program, it's important that you talk with your doctor about this. They may want to do an EKG, they may do stress testing to assess your cardiovascular risk.
It's really, really important that if you have diabetes type 1 or type 2 that you at least get an annual eye exam. But the serious problems from diabetes occur in the back of the eye and the retina. If you have retina problems from diabetes, you can really have profound, irreversible vision loss. Fortunately, we can treat many of those problems before they steal your vision.
We know that diabetes affects foot health a lot, and the reason is because diabetes affects the nerves in the feet and it affects blood flow.
Patients with diabetes should be seen regularly for foot evaluations, and it's really just as a preventive measure because we want to avoid the complications of diabetes, such as ulceration and amputations. It's very important that you wear proper fitting shoes. It's very important that if somebody notices a wound or a cut on their foot, that they don't ignore it and think it will go away.
Diabetes is the most common reason for end-stage kidney disease and the reason why people get on dialysis. Diabetes is bad for the kidneys. Your doctor can do blood tests to check the kidney function, but more importantly, he or she can check your urine for the presence of protein. If you have too much protein in the urine, that means that the kidneys are not healthy.
Having a diagnosis of diabetes does increase your risk of cavities as well as gum problems. So important to take really good care of your teeth because some of these infections in the mouth or in the gums can also raise your blood sugar.
Diabetes affects your immune system. So if you have diabetes, you may not fight off infections as well. So it's extra important for diabetics to get regular vaccines.
Typically, diabetic patients should have their flu vaccines. They should be up to date with their pneumonia vaccines, and many other vaccines may also be indicated, so it's important to discuss this with your physician.
But our hope is that in preventing and controlling a person's diabetes and keeping their sugars low, that we will mitigate and reduce the risk of these complications happening. So that's our focus, is to try and prevent these things from developing or from getting worse.